Hey guys, my name is Kevin. I'm one of the exercise specialists with the West Primary Care Network, and today we are here to talk about pre-screening. So as exercise physiologists, it's a really important thing for us to make sure that people are safe to start exercising. A lot of the times we're working with people with stable or unstable medical conditions like diabetes and high blood pressure, pain, heart disease, cancer, anything like that. So what our governing body has come up with, they're called CSEP, the Canadian Society of Exercise Physiologists. Our pre-screening tool that we use is called the Get Active Questionnaire. So the Get Active Questionnaire, I would like you to Google it and to go through it yourself. I would advise looking at the reference document. That one asks you the question and also gives you a bit of an explanation afterwards if you do say yes to the question. Okay, so I'm going to go through them quickly with you guys. So question number 1 is a diagnosis or treatment of heart disease or stroke, or pain, pressure, tenderness, or tightness in your chest that you develop with physical activity. So if you start getting more active and you notice any of those symptoms come on and it goes away with rest, then that's a do not pass go. Go talk to your family doctor. Or if you just have unstable chest pain, I would like clearance from your doctor before you start getting more active. Question number 2 is, do you have high blood pressure above 160 as your top number or above 90 as your bottom number? If it is above those, we do want to get it treated with medication or diet before starting exercising. It's just starting a little bit too high as your blood pressure does go up temporarily during exercise. Question number 3, dizziness or lightheadedness during physical activity. So lots of people say yes to this. I went down to the ground, picked something up, and stood up, and you get lightheaded. That's not what we're looking for. We're looking for if you're out for a walk and you start to get lightheaded or dizzy during your physical activity. If that happens, please talk to your doctor. Question number 4, loss of consciousness or fainting for any reason. If that's happening and we don't know why you're fainting, then obviously physical activity is dangerous, so that's another do not pass go. Or a concussion in the last 6 months. So if you're having any post-concussion symptoms, it's really important not to bring that on with physical activity. So that I would seek guidance from a physio, doctor, or exercise physiologist on how to exercise with symptoms of concussion or post-concussion syndrome. 7, 8, and 9 are, do you have any pain or swelling in any part of your body? Lots of people that we work with do. Most of the time, some movement is good. It's just a question of how much movement. So we have another video called Exercising with Pain. Please reference that video for more advice on how to move if you do have pain in any one of your joints. 8, has a healthcare practitioner told you should avoid or modify some physical activity? During this time, that if you're watching this video and we can't have a conversation about it, I'm just going to say take their advice. If you can, please talk to an exercise specialist and we'll help you kind of understand that guidance that the other provider has given you. And 9, do you have any other medical conditions? So diabetes, high blood pressure, high cholesterol, all those things we're just trying to make sure are stable before you're active. Blood pressure I went over already. I would consider diabetes. I wouldn't exercise if you're below, or start exercising if you're below 6, and no exercise if you're above, let's say 14 to 16. There's 2 different guidelines there. But if you're too high, exercise can be bad for you. Your blood is like syrup. If you're too low, you might not have enough energy on board to get started. So reference the document, read through what's there. But overall, activity is for most people very, very safe and very, very necessary, especially during this time that we're all spending indoors. So try to get active, but we want to make sure you're safe. Exercise specialists are here to support you, and so is your family doctor. Canada's physical activity guidelines basically point towards 2 main things. Number 1 is 150 minutes per week of physical activity, of aerobic physical activity, in bouts of 10 minutes or longer. Point number 2 is 2 days per week of strength training. So we have other videos to give you guidance on, I guess, me elaborating a lot more on those. So please tune into those if you are safe for exercise. That's all, and thanks for watching.